voice our concern and our problems, and we are really concerned, and we want to know when we're going to get paid. And if we're not paid, we're going to continue to strike. We're not going to work because it's not fair. It's not fair to us. You have single parents.
I am
a
single parent.
Maturity, they never say in the contract, like if it's that you get a child or you're pregnant or you go maternity leave, you're not entitled to gratuity. Like nurses never receive the gratuity because they get baby. Imagine you have an extra amount to feed and you're getting no money. You have to be afraid to make children. Why? We are working at so many risks at Linden. We're working at risk in Linden. Look at what happened at the nurses. And the situation has not resolved. We've been working at risk. We're working TB patients, direct contact, which is airborne, and nobody's doing anything. Come on, and now you don't want to give me money? What is that? What is that? Thank you.
From Linden, maybe last week.
It's not fair to risk your life.
No, that's hard work. I was a nurse in London. Very hard work. No, you should be paid.
Some work is very risky. Something you don't start when you do know the patient that it's too late. We don't put ourselves at risk. Right now, the hard is that loves to be work.
We need to change them if it's a management or the
No, we gotta say these things.
You gotta pay y'all. That's what I gotta do. Pay y'all. That's what I gotta do. Pay you. You work. You have a contract.
2 appraisals going for me, and then I didn't get no money. And my appraisal going twice, and I didn't get no money. And I'm a single parent. Right now today, I need my two children in somebody's arm.
PM. Wait, it's me, you?
Exactly.
It's not
It's
me.
so
It's
simple.
not
It might
me
take 3
and
weeks.
you.
Respect the nurses. Respect the nurses. Respect our 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 nurses.
Enshrined in their contract that they entitled to this payment on March, in the month of March. And here today, they didn't receive a single cent. And they're simply asking the authority, including the minister responsible for health, Barry Ramsaran, so just give them an explanation why they wasn't paid and who were responsible. What is the reason for them not being paid? They're being told a number of reasons, which to the nurses here does not bear resemblance of any reasonable explanation. Some of it is being that there has to be an appraisal be submitted to the Central Accounting Unit in order for the process, the gratuity. Now gratuity is due every 6 months. Everybody knows it is due every 6 months based on the date of appointment. So they had about a number of nurses. How many nurses maybe?
75% did not receive it.
75% that received the gratuity, and the explanation
Was late appraisal.
late appraisal.
However, person signed appraisal since in January 1 and did not receive the gratuity. So we asking why haven't they received it if it's late appraisal? What happened there?
Correct. And here you have it from the nurse herself and the nurses. Here the appraisal was signed in January. You know, pay changes, they're going to want to see pay changes have to be submitted early because salary is paid early in January, February, and so forth. But in cases there's appraisal that was signed since January, what's the explanation there? Apparently there is no explanation. I don't know if these particular 75 nurses are being harassed for some reason, which we don't know. Only the Ministry of Health could know this information. But I'm going to ask you, do you have any reason that they want to harass the 75 nurses?
Well, that's the thing, we don't know because it's random. You have theater staff, maternity ward staff didn't receive the gratuity, and there are also other departments, like some of the attendants didn't get, one person at lab didn't get. So we don't know if this if it's something that's being vindictive, they're being vindictive about it. But what I know, the explanation as relates to late appraisal doesn't make any sense. Because person signed things in January, so why haven't they received theirs? I don't get it.
I don't get it either. And that is the reason why I'm saying, trying to explain to the members of the public. It doesn't have any explanation of late appraisal. That's the reason why you couldn't get the gratuity, because since January, most of the nurses out here that protested did sign the appraisal. Contract gratuity is based on performance. We all know that. If you don't perform, you can't get paid. But these nurses did perform. They have evidence to show the media, they have evidence to show the public that these nurses, 75 nurses, did not perform. If not so, the problem is within the administrative arrangement to pay these nurses the gratuity. And these nurses must be given an answer when they will be paid. I don't think they will be able to be paid in April because the payroll already went through. So I don't know if it's May month they promised you. What they said to you?
Well, like I said, initially at the meeting, they said to us that they would have tried to get it on April pay. But we refused because we said our money should be paid in March. However, another word came around to say that one of the minister is saying that they can only afford $1 million, to pay $1 million. And we must send a list. Because I'm asking, 75 persons, aren't they in dire need? We work. We would risk every day of our lives. So at least you can pay us.
Well,
that's the option, and we hear and nothing else. It's just a promise every day. Today is a meeting, is another meeting, and then they send somebody to Linden saying that and he wasn't even aware why he was in Linden. And every day and another day is a promise, claiming it's tomorrow, another day. Now they're saying somebody said 4 o'clock this off, and then they said someone in the ministry said soon, and I don't know what is soon.
Okay, well, that explanation you just gave me gave a next element to the story. It means that the government is saying indirectly they don't have funds to pay you, and that
So
may
where will
be
they get started
and,
22nd?
and that may be the reason why they didn't pay. If they said the only 1 million is available, it means that the reason they didn't pay you is not because of appraisal problem, because of funding problem. But added to that, what must be noted that the FMAS system is in place there. You don't have to wait in a payroll. They could create individual vendor codes for the 75 of you and have checks cut in your name. So there's no excuse. I know how the system operates, and I could say to the Minister of Finance, the Minister of Health, that these nurses could be paid within 1 hour because the system could facilitate such action. Thank you.
I'm at risk every day. I'm at risk for working, and I'm at risk. Like you rightly said, an incident where a nurse was molested, sexually abused, nothing was done, but we still went back to work. And every day we go to work and we work, we even do the doctor works. Invasive procedure, we're not supposed to do what we do it. We do catheterization, we do infusion, we start those things. We go beyond the call of duty, we go beyond the call of our job description. And no, you're trying to make you're trying to make a fool out of us by saying every single day it's not a problem, it's not a promise, every day, and you keep postponing it. We're single parents and we need our money. We have bills to pay, we have to eat, we have to travel. We have to get to work. And I'm pleading with whoever is responsible for paying us, can we kindly have our money that is due to us? Because my contract did not stipulate that my appraisal has to be in at a certain time, or it never even state that you have to have appraisal. They don't say gratuity is being paid every 6 months, that's it. If you want that in the contract, put it in the contract, but it's not there. And I need my money. Thanks.